We use the word metal, we use the word amalgam, silver fillings. They're all the same. They're half mercury and half silver, and they add other alloys in there. So a lot of people are going to their dental offices. They're saying, take them all out. It's not being done properly, and they just inhaled a lot of mercury. Daily use of mouthwash, complete waste of your time. And if it's causing high blood pressure and affecting your insulin resistance, why would you even take that chance? And there's no therapeutic benefit from it. People have lived with root canals for a long time. Someone who has a root canal here does not get breast cancer on this side. These are all myths. Can you get cancer from a root canal? Yes, but it's not on the same side. I mean, that's not how the body works. A lot of people are looking for that magic bullet, like I'm continually sick, my joints hurt, my CRP is elevated, I don't have a lot of energy. They say, I think it's my cavitation. Can you just take care of it? And I say no. If your toothpaste is foaming, that's a bad sign. In fact, there have been ad campaigns on how my toothpaste foams and how wonderful that is. It's not. It's just a byproduct of something that they put in there, and they didn't want to alarm the end user, so they said foaming is good. Big picture is that the industry that is selling you products for oral care, most of this is based on junk science or no science.
What are the biggest dietary mistakes you see people making that are having a negative impact on their oral health?
Well, when it comes to mistakes, and I hate to use that word mistakes, but lifestyle choices that affect overall health, and we're talking about oral health here, it's one of the big categories in oral health. In fact, it could be the largest. And, we have a completely different diet than our ancestors. They were gnawing on bones. They were getting every last little piece of meat and collagen. And we go to the grocery store and buy something that's packaged. The texture is different. It's not as hard to chew. So there's texture, there's the quality of the food, there are the toxins in the food, and then there's the processed nature of the food. So the biggest, I'll just cut to the chase, just so people have context and have an easy example. There are lots of healthy, quote unquote, healthy potato chips, crackers that have whole grains. Maybe they use olive oil instead of an industrial seed oil. That still is a processed food. And when the bacteria in the mouth, the oral microbiome, sees that broken down, where the weed is broken down, even if it's a healthy weed or non-GMO or, brown or dark or even rye, you hear millet may be better, but anything that is broken down into smaller pieces, ground up, enriched, bleached, the bacteria in the mouth have a heyday with that. I always pick on goldfish crackers. It could be saltines. It can be potato chips. These are products that are very convenient that parents will throw, into the kids' carriage, and as they push them through the park, and if they need a snack, it's easy. I would argue that a meat stick is better because the texture is harder. It's something that they have to chew on, which helps the jaw develop correctly. I think it tastes better. It's a more nutrient-wise, it's more dense. Obviously, it's got saturated fats in it, animal fat, vitamin K2. These are things that we need for developing children and dentitions and jawbones and facial structure. But throwing them even a power bar that dates me right there. Power bar was the first sports bar, like a Cliff bar, or I'm not just picking on Cliff. It's all of them. If there are more than 2 or 3 ingredients, and the first ingredient is some kind of natural sugar like date sugar or something, or agave, that's a mistake. That is not nutrition for the oral microbiome. So if you're feeding the oral microbiome these kind of processed, ultra processed foods, of course, candy's on the list. Obviously, everyone knows that. Hard candy, sticky fruit, fruit rolls. Again, that's a processed food. I'd rather have you eat just fruit, the whole fruit, instead of a fruit roll. Then this will lead to a dysbiosis of the oral microbiome. In other words, the wrong bugs will become dominant in your mouth, in that oral microbiome population, and all hell breaks loose. You start getting high acid levels or low pH. Teeth start demineralizing. The nature and substance and the consistency of your saliva will change. And that's not to mention the systemic effects. When you eat goldfish crackers, your kid's going to be hungry in about 45, 60 minutes. Or if they eat a meat stick or two, they may not be hungry for 4 or 5 hours. So I can get into specific foods if you want, good or bad, but I mean, any kind of junk food, if it comes in a bag, if it's processed, if it's a paleo, like a piece of chicken that you've cooked in the pot and seasoned with butter or olive oil and some spices, there's no chance of the bacteria going to town on that. They cannot, it's not a fermentable carbohydrate. It does not ferment, and there's no acid production from it. So high protein, animal fat is good. A paleo diet, if you are into keto, that's fine for the oral microbiome. But stay away from the snacks and the carbs, especially if it's processed.
That all makes sense. But for the person who, on occasion, has one of these healthy, quote unquote, bars or crackers, because say we're in a pinch or because we're human and we still, introduce those things to us or our children at times, when that happens, what is the best way to protect the oral microbiome?
And that's a great question, because it's not a perfect world. And I'm first to admit, when I'm on the road or in a food desert or on a plane, for example, for 6 hours, I try and bring my own food, of course, or not eat. It's difficult. And then there's a state of awareness. Not everyone is aware that a goldfish cracker is a cavity-causing product. I mean, it's not widely known. So that's an easy answer. Just pull out a piece of xylitol gum, high quality piece of xylitol gum, get that saliva flow going, suppress, not kill, but suppress or deactivate a bug that causes the decay, the S. mutans bug. Xylitol is fantastic at doing that. It's been known for a long time. You can brush your teeth if you want. That's kind of difficult when you're at school or at work, on a plane, and you should wait 20, 30 minutes before you do that. You can swish with water. These are all pH stabilizing agents. So xylitol is better because it has other actions other than stabilizing pH. You want to bring that pH up to 7, a neutral pH, which is the normal pH for the oral microbiome. But if you're at a pH of 2.5 to 3 or 4, the biome is not going to do well, and your teeth are losing calcium. The teeth are literally dissolving in your mouth.
You mentioned there to wait 20, 30 minutes if we're going to brush our teeth after having something, higher in carbohydrate. Talk about the physiology there and the specifics of why that is.
It's important to know this because the short answer that dentists have been giving for a long time is brush your teeth. You can eat whatever you want, just brush your teeth. Well, it turns out that when the pH is very low, let's say you've consumed something that is acidic in nature. Some mineral waters are low in pH. Coffee is low in pH. Alcoholic drinks are low in pH. A lot of these sports beverages, even and I just discovered this recently, these electrolyte drinks. There was one that was a sponsor of my podcast, and the pH was 2.4. Very well known electrolyte company. And I'm not recommending electrolytes. I think they're good, but there are a lot of things that have a low pH. So if you're consuming them, you're at work, you're sipping a Diet Coke, even that's high in acid, even though it doesn't have sugar in it. That frequency is lowering the pH in your mouth. And then there's another pH moment that is compounded by ingesting acidic beverages and foods. And that is a food that creates an acidic event. And we talked about that, the goldfish. So you're fermenting a snack, a carbohydrate, and the bacteria consume that readily fermentable and digestible product because it's been processed and broken down. And then they produce an acid. Their metabolism produces a byproduct, and that is a highly acidic product. And so you're lowering the pH just by eating a cracker, which doesn't really have a pH per se. So usually we're consuming the acidic beverage with the acid producing snack, And if you do it a lot during the day, or if you do it for long periods of time, you're just sitting there snacking over an hour, working on a document at work. That is just too much for the body. In other words, it cannot handle that state of demineralization. So if you were to brush in that period of time, let's say you've had your 30 minutes of snacking, and you want to be a good patient, and you're doing what your patient or your dentist or your hygienist told you to do, and that is to brush after you eat something that you shouldn't have eaten, that is likely a mistake, because in that acidic environment, if you're anything under a pH of 5.5, if you go in there with some nylon bristles, even a high quality toothbrush, a mildly abrasive toothpaste. Most of toothpaste are abrasive. That's how they work. It's kind of like dishwasher detergent. That's how it works. It's not just soap and emulsifiers. It's a little bit of a abrasive powder that gets squirted around to scrape your dishes. Same concept. You literally are brushing your tooth at its most vulnerable state, and that is in a state of flux where it's releasing calcium ions. It's releasing the actual components of its structure: hydroxyapatite, which is calcium, phosphate, and hydrogen ions, but essentially calcium. Now, if you were to wait until the body has come back to a normal pH, a neutral pH, and in doing so, it's trying to remineralize those teeth. There's a system in place to take all that lost calcium and to put it back in. Then that is the best time to brush. And so I think we've been giving the wrong message for a long time in the profession, but it's catching on now. Wait 30 minutes. This is after a cup of coffee. A lot of people will brush right after coffee because they think there's some stain, residual stain, or coffee, the tannins in wine, tea and wine. They think if they brush right afterwards that they are removing those stains. In fact, they're not. And secondarily, they are scraping away healthy, good tooth structure. And that's why a lot of people that do that have sensitive teeth. They have very porous teeth. The root structure is porous. And when they ingest something like some cold water or ice cream, they cringe. So you got to give it 30 minutes. Now, you can hasten that process. You could swish with water. You can chew xylitol gum. There are lozenges. There are pH balancing lozenges and pastules that you can put in your mouth. And if you can bring that pH up, and there are ways to measure pH to figure out how long that takes in your mouth based on the snack you ate, then you can brush at that point. It's a safe time to brush. But I would argue that if you're at work, you had a snack, and you chew xylitol gum, and you know how much xylitol there is in there, you want 2 to 4 grams of xylitol in each piece of gum. You chew it for a few minutes, swish with some water. You should be fine. You shouldn't have to brush in 30 minutes. So that 30-minute kind of threshold is very important.
If you're enjoying this episode, take a second and let me know by clicking like and subscribe below. Thank you so much, and now back to the show. Okay, so acidity aside, talk about physiology of xylitol in the mouth and then in the gut, because everything's connected there. So if somebody's chewing xylitol gum in between meals, when they're having snacks or after meals, just because it's good for the oral microbiome, is it good for the gut as well?
So this is where we get a lot of people hesitating on xylitol. As many are aware, and I'm sure you are as well, Jesse, there was that study that just came out from Cleveland Clinic. First they picked on erythritol. Now they're picking on xylitol. I'm afraid allulose will be next. These are all wonderful sugar alcohols that are not digestible, not fermentable, that are great for diabetics. They're great for people that are trying to lose weight, not to spike their blood sugar levels. And they're better than artificial sugars, man-made artificial sugars. They have a real checkered past in that regard. So the good news is that those studies, in one sentence, basically said this really doesn't apply to chewing xylitol in gum for the oral care side of things, and I appreciated that in the study. And I think more study is required. The studies claim that if you ingest a lot of xylitol, that there will be cardiovascular complications, clotting and all of that. There were a lot of problems with that study. We don't need to get into that. I've posted something about that in the last few days, and I'll be doing more on that. But obviously, if you're chewing xylitol gum, you don't have to worry. A little bit of it will get absorbed. The mouth does absorb things and into the bloodstream through the oral mucosa, but it's just not enough to worry about. So, in terms of the mechanism of xylitol, it's a prebiotic. It does have an effect on the gut if you ingest a lot of xylitol. And there are some people that if they chew a lot of xylitol gum, they will get a little gas, a little not indigestion, but they'll get a little distended. They will feel the effects of that. And there are people that are sensitive to everything in life. And if that's the case, then experiment with dosing and see what works well for you. But and xylitol has some benefits for the gut, but if you can upstream, let's talk upstream, in the mouth, that the oral microbiome is connected to the gut microbiome, and there's probably a two-way communication, and there's also a gut oral microbiome with the brain axis as well, and that's poorly understood, but at least we recognize that there is something to that. So chewing xylitol in the mouth to help the oral microbiome, to help, let's say you're a kid, you're 2 years old, and your mother has a very high decay rate. Why is that a big deal? Well, mom's going to pass on she's sharing her oral microbiome with her child, and her child will have also a very high decay rate. But if the mom is chewing xylitol, and if the kid, actually, if only the mom is chewing the xylitol, there are huge benefits. But let's say everyone in the family is chewing xylitol. That would be a good thing. The studies indicate that there is a reduction up to 90, I think it's 92, 93% of decay for the children if xylitol is in the picture. So, if you're after a meal, chew some xylitol. If you're a kid or an adult, that not only acts as a prebiotic and supports the oral microbiome, but it also... its main mechanism, the feature that we like as functional dentists, is that it really selectively looks at the S-mutan bugs, which is the bug that is on your biofilm, on your tooth, producing those acids, drilling deep into your teeth, and it just kind of deactivates them. It doesn't take them away. It's not harsh, and it doesn't pick on other bacteria. So it's very selective. It's discriminant, and it's safe for the oral microbiome. And that's why we love xylitol so much. There are some dentists on influencers that are dead set against xylitol. I can only think of one, but that's the nature of the beast. There's always someone out there that thinks it's bad, and then they're the sources of xylitol, and synthetic xylitol is fine. It works well, and it's actually better for the environment to use synthetic xylitol. So it's a wonderful product, and by chewing it and helping the oral microbiome maintain its state of commensal health and wellness, you are indirectly helping your gut microbiome. And there are all sorts of connections now between the oral microbiome and IBS and other gut disorders, and that's all that information is coming online now. So,
are you aware of other ways people are using xylitol?
Yes.
For me, it's only gum. I can't think of any other ways.
Oh, no.
Are people putting in smoothies to sweeten those, or how else is it being used?
Yeah, no, that's a great question. I'm glad you asked that, and I should have mentioned it. But so they do put it in smoothies. If a lot of diabetics, type 1, type 2, are baking with it. I prefer monk fruit just because of flavor. Allulose is coming online. A friend of mine, Dr. David Perlmutter, which most of your listeners will know, he is big on allulose. I like what he says about it. It's being now used in other countries, in Mexico, in breakfast cereals for everyone, and it's really having an effect. It's a great way to reduce the incidence of diabetes in this country, and it's working in Mexico. So these are sugars that are being used in food products. Of course, it would be better if we just got off the sugar thing, right? Or the taste of sugar, the flavor. But that's okay. I mean, there are substitutes. But here is the interesting use of xylitol in nasal sprays. There is a nasal biome, which, as a functional dentist, I am very much into and fascinated by, and very appreciative of. I kind of include it in part of how we deal with patients. It has to do with mouth breathing as opposed to nose breathing, nasal breathing, and all of that. But there is a wonderful product out there, which I've been recommending for, probably 10 years. It's called Clear. It's spelled Xclear. They have different versions of it. One has a little pepper in it if you're really congested. But my wife and I use that a lot. My whole family uses that a lot. I recommend that to my patients. It is a prebiotic and selectively picking out certain bacteria in the nasal biome that predispose you to respiratory diseases and maintains the nasal biome. So what a great, and this may sound kind of gross. I don't neti pot. My wife does. But if you spray it in there, you get a little bit of a sweet taste in the back of your throat. So, I mean, it's wonderful. I highly recommend that if you want to decongest naturally, if you have problems nasal breathing. My wife will use it before she goes to bed at night, before mouth taping. So there are other uses of xylitol, and I'm sure there are more that we haven't discussed.
All right. So just to be clear, you're a fan of it for the nose, in gum form for the mouth.
Yep.
Any concern at all with that research you talked about if somebody's using it, say in a smoothie or ingesting it in the gut?
As I said a few minutes ago, more study is needed on that. There are some people that are very sensitive to it. So if you are sensitive to it and it makes you bloat and you don't feel well after ingesting it, try something else. And if you have heart disease, I think in the meantime, if you have clotting issues, you're throwing clots, strokes run in the family, you're getting older, you're predisposed to it in some way, why not? I mean, you don't need xylitol. By the way, your body makes xylitol. It is endogenous, and not a lot, but it is something that the body makes. So, I think in that study, the lead researcher, I forget his name, he essentially recommended, based on his findings, and again, this is all by association, but based on his findings, he said, eat more honey, eat more sugar. and I just don't think that's good advice. I can't do that as a dentist. I've given up sugar. It took me a long time to do it. I had to cure my sleep apnea first, because when you're not sleeping well, you're low on energy, you crave carbs. But becoming fat adapted, going to a paleo diet, high protein animal fat diet, it can be done. We really need to lose that taste for sweetness. It is on our tongue. We were wired to like it, and it's a little overdone, and now it's easy to get. So I think if you can, don't use xylitol in your food. Try not to sweeten your food. Use it in your toothpaste. Use it in your gum. Use it in your nasal sprays. I do like it for that. But if you can, let's not ingest it. Use monk fruit in the meantime until bad reports come out on that.
Got it. So a big part of your message when it comes to oral health is to optimize the microbiome there. Hence the name of your company, FYGG, Feed Your Good Guys. We know now that xylitol is great for the oral microbiome and the nasal. What else can we do specifically in those two areas to optimize the microbiome?
There are certainly other areas. It's not just diet. It's not just oral care products. So we talked about that. Diet, optimize that. Oral care products, make sure that everything is oral microbiome friendly. Most are not. The whole industry for the last century has been based on disinfecting the mouth. I think that message is getting through to people. And then the other thing, another big issue or factor that we have control over is the pH of saliva, the consistency of saliva, the amount of saliva in the mouth. And that relates back to how much mouth breathing we do. Unfortunately, there are bigger picture issues in our species as we, in the last second of our existence, we have become agrarian, and our lifestyle has changed dramatically, so much so that we're just beginning to notice it. There's a great quote on that. I'll try and find it on that timeline. But, the majority of our time, 99% of our time on this planet has been eating a certain diet. And it's just the last 1% where we've changed it drastically. And now we're beginning to see the signs of, or the ramifications of that. And one of them is facial development. So because facial development is off, we're breathing through our mouth, which is drying out our mouths. We lose a liter of saliva. I mean, it's no wonder electrolytes are so popular, and hydration is so important, has become so important. Our mouths are always open when we sleep at night, for example. That's the easy target. You're sitting there for 6, 7, 8 hours, hopefully 7 or 8, and your mouth is open, you're losing a lot of moisture. If you're getting up in the middle of the night, your mouth is dry, you're thirsty. If your mouth is very sticky in the morning, and the first thing you want to do is deal with that thirst, or the quenching your thirst kind of response. That's not really normal. Obviously, you should drink a lot in the morning because you haven't had anything for 7 hours. But we lose a lot of moisture through our mouth. In doing so, the oral microbiome is affected. The oral microbiome needs the body of saliva. It's a communicator. It's transport. Essentially, it gets it to the biofilm. It gets it to other parts of the mouth, or all these little niches in the mouth that have different types of environments. We call those the micro niches, or the niches of the oral microbiome in the mouth. The nasal biome is a niche, So saliva has to be present for the oral microbiome to be doing its job. And as soon as you start losing that saliva, your pH drops. And if you start moving the needle down to a negative pH, an acidic pH of 2, 3, or 4, even 5, different bacteria colonize, and they tend to be the more virulent ones, the bad boys, and not the good guys. And that's they're always there. The bad guys are always there, and sometimes the bad guys have good functions when they're in check. Again, it's very complicated, and this is where AI hopefully will help us nail down what goes on in the mouth with the oral microbiome. But you need a stable pH, and if you're mouth breathing a lot, it's not going to happen. If you're talking a lot like we are for the next hour and a half, you should be sipping water. You need to replenish. You need to be well hydrated internally. If you are dehydrated, one of the first things that happens is your mouth gets very parched. You're not producing saliva. If you're always thirsty, or let's say you're in the desert and you haven't had water for a day or two, probably less than that, a day or two is pretty serious. We really can't do that well. Guess what? Your body shuts down the saliva glands. And then the oral microbiome basically suffers. It becomes just a cesspool. And then you get oral ulcerations. You get bad breath. Your tongue starts cracking. Your lips start cracking. Your nasal biome has issues as well. So that would be the third big category, is how are you maintaining your hydration and how it relates to how much you're losing, how much moisture you're losing. And one aspect would be mouth breathing. So it's important to breathe through your nose. When you breathe through your nose, you're humidifying things. You're not drying out. You're not taking away moisture in the mouth. In fact, you're humidifying the air before it goes into the lungs, which is a wonderful thing, and warming it as well.
Earlier, you talked about the fact that recently you noticed the electrolyte you're recommending and using was dropping the pH. This ties into the hydration piece you just brought up. What have you done in that realm? Is it just being more conscious of when you're using that, changing brands? Talk more about that piece.
Yeah, no, I'm glad you brought that up. Changed brands. It was interesting. A wonderful company. I'm not going to mention their name. And big seller. Interesting ratio of magnesium to the other electrolytes, minerals. But the pH, they add citric acid to these electrolyte powders, and the pH. So I have a $500 pH meter. I measure pH of everything that goes into my patients' mouths, and toothpaste, of course, and mouthwashes and foods, and it has to be calibrated, and it's a big deal. So when I do that, I have a whole bunch of things out on the counter. And so I noticed I was using the product and I was enjoying it, and we had invested in the product. And I noticed that my teeth started getting sensitive. It took about 4 or 5 days. And I know that very well. I know that cycle very well. Then I had to I started using my varnish, which is a stronger version of regular toothpaste with nanohydroxyapatite in it. That was helping, but I really had to use a lot of it and frequently. And then it occurred to me that this product, because it was the only thing that I had added, was maybe the culprit. So I measured the pH. It was 2.4. I did reach out to the company, never heard back. Reached out to some other people. They also tested and confirmed that. And then somewhere in the literature, I was able to see that it was 2.4. And 2.4 is just too low. There are a lot of sports drinks that are that low. There's some colas, some sodas that are that low. If you're going to sip it quickly and then chew some xylitol gum and you're done with it, fine. But I was taking my electrolytes twice a day, so I changed brands and I researched everything. Taste is very important to me. It had a different ratio of minerals, but I was able to fix that just by how often I did it. So twice a day, I take my new electrolyte, and that has a pH of 6.4. And to me, that's fine. That is just below neutral. Aim for something over 5.5. That's when, at 5.5, we start, in all the studies, we start seeing dissolution of minerals, calcium from dentin. Obviously, it happens quicker with dentin. But enamel's harder, and then enamel starts at a little bit lower than that. But 5.5 is a good kind of baseline. And remember, a lot of mineral waters are below 5.5. So just analyze or look at what we have on our website. We make recommendations. Even tap water. I measure tap water sometimes in certain areas, and I've measured tap water down to 5.5. And that's not good. So if you're ingesting something every day, make sure you really know what the pH is. And if your teeth are getting sensitive from all these drinks, and a lot of people aren't drinking electrolytes, they're just drinking all these sport drinks and sodas, and even kombucha is on that list. I've measured some kombuchas that are at just below 3. A pH of 3. These are drinks that we sip on, we enjoy, that we have 2, 3, 4 times a day. There is a price to be paid for that. And again, don't brush afterwards, chew your xylitol gum, and know your pH.
Last time you were on the show, we went deep into your whole oral care routine, toothpaste you're using, toothbrush, floss. We went really deep. We got into all the nuance. For people that are interested in that, which I highly recommend going back and listening or watching that, let's give people just the general overview. We won't get into the detail we got into last time, but give people an idea who haven't tuned into that conversation yet, your general oral care routine, and maybe some things have changed in the last number of months too. So give us a few minutes on what the current practice is.
Sure. This is something that everyone wants to know, and I'm happy to go through it in whatever details required. Big picture is that the industry that is selling you products for oral care, and I include the profession of dentistry as well. There are a lot of dentists that sell products. There are a lot of non-dentists that sell products. There are big corporations that sell products, and most of this is based on junk science or no science, and it's been that way for the last century. And if you buy something at Target and it's a major brand, it could be a Procter & Gamble product, it could be a GlaxoSmithKline product, Lever Brother. These are all the big companies, Colgate, Crest. These are toothpaste that appear on that shelf for about 30, 40 cents, boxed. All the marketing's been done, and they sell it to you for $4 to $5, and they contain fluoride. These are products that are based on, again, I'm not going to use the word science, but on a notion and falsehoods that have been around for 100 years, and dentistry has been behind them. I mean, we're not guilty of being part of this. So the first thing you want to do with oral care, whether it's brushing, flossing, tongue scraping, using mouthwash, using toothpaste, is you have to make sure that your products are oral microbiome friendly. Again, the oral microbiome was discovered or defined in late, the 2010s, like 2008, 2009, maybe 2005, 2006. And so it's a recent thing. And how long does it take for an industry to react to that? Well, the profession is just now getting on the bandwagon. I'm seeing some change. We've been literally proselytizing, preaching this on Ask the Dentist for about 10, 12 years. And our major kind of comment was it's going to take 10 to 20 years for this to change. And that's the difference we see between the latest studies and when it gets the delta between the latest information in the studies and when it gets incorporated into a medical or dental curriculum. It's not in it's appearing in the curriculum. It's more in the continuing education, and the more kind of smarter, more the practitioners that are question things like, why are all my patients getting gum disease? Why is it so prevalent? Why are all the kids getting cavities? What am I dealing with here? They're the ones that are asking this question, and they find this information online through continuing education. So your products need to be oral microbiome friendly. Now, having said that, how many products out there are oral microbiome friendly? Very, very few. In fact, it's going to be a boutique product. It's going to be costly. It's going to cost 2 to 3 times more than that Colgate or Crest on the market. We also know that mouthwash, 99% of mouthwash is bad for you. It increases your blood pressure. It affects NO production. It also increases your insulin sensitivity. Amazing that we didn't know this. Those studies, the first study is as early as, I think, 1997, a whole bunch. There were a few in 2005, 2006, and now we're seeing a lot more. So don't use mouthwash. Scrape your tongue instead. There's nothing wrong with scraping your tongue. Use a tongue scraper. That is the wide tongue scraper. Don't use a toothbrush. It takes too long. Doesn't work very well. And brush twice a day, but don't brush right after a meal. You got to take care of your oral microbiome and use the right products. Use products that have prebiotics in them. L-arginine, for example. They have no emulsifiers, no surfactants. A lot of toothpaste companies say they don't have surfactants in it. They've replaced it with a new surfactant that has a different name. So know your surfactants. These are products that are in toothpaste designed just to help make big batches, and it actually thins and makes your oral mucosa more permeable. It predisposes you to canker sores. It has other effects. It can be bactericidal. And then stay away from essential oils. Essential oils were being added as a preservative to help preserve and make the product smell and look desirable. They're bactericidal. They have an effect on the oral microbiome. So really, your toothpaste should be something much different than probably what you're used to. That requires some research. There's plenty of information on the web. There's a lot of misinformation on the web. We won't get into that, or we can talk about that later. But keep it simple. If you eat well, if you keep your mouth closed, and you've got the right pH of saliva, you're really not going to have to focus too much on all of these on this regimen. There is no magic bullet. Flossing is important. I would not use a nylon floss that has PFAS in it. We've been saying that for years. We refer to it differently: microplastics, nylon breaking off in the mouth. Now we have different names for it. Stay away from that stuff. We have silk floss, which is biodegradable. We do have safer, softer toothbrushes. Replace your toothbrush often. Nylon bristles are abrasive. Make sure you're brushing correctly. No back and forth sawing motion, jiggling, massage the gums. There are lymph channels in your gums. You do want to massage the gums with a toothbrush. You can also use the tip of your finger if you want. Floss. There are new flossers out, electric flossers, that are absolutely amazing. I do recommend one, which I absolutely can't believe how good it is in terms of benefit and results, and then use the right toothpaste. And in general, stay away from mouthwash, even if it's salty water or flavored, safely. Just clean water. You can just use clean water. You don't have to go out and buy a mouthwash. So, and then scrape your tongue. Scraping your tongue is something you definitely want to do. That has major benefits for the oral microbiome.
So none of the mouthwashes that are commercially available you'd use?
I wouldn't. I mean, the really healthy organic ones, I mean, you're paying for something. I would spend it on the toothpaste. Mouthwash is intermittent. It's just, it goes quickly. Now, if you have a very dysbiotic oral microbiome and you are very sick and you've got rheumatoid arthritis, you've got heart disease, Alzheimer's runs in your family, and your gums are bleeding and you have bad breath and you have high decay rate, you're going to need an aggressive mouthwash and dental work and other things all at once to reset the oral microbiome. And that would be for a period of 2 to 3 weeks to reset it. You could even be put on antibiotics, aggressive antibiotics. And that's a very sad state. But I mean, some of us are there and we need that. You can't say no mouthwash at that point. But daily use of mouthwash, complete waste of your time. Time is valuable. Complete waste of your counter space. That can be valuable in certain households, depends on how many kids you have. And also money. I mean, and if it's causing high blood pressure and affecting your resistance or insulin resistance, why would you even take that chance? And there's no therapeutic benefit from it. You could have a few essential oils, and it's just a waste of time. Even the essential oils are bad. And I know a lot of people that have burned their mouths with very healthy, natural, homeopathic mouthwashes. Again, the action of liquid is only as good as stabilizing pH quickly, because you're adding a high pH water, hopefully 7 or higher. And the minute you add that to water, you're moisturizing the mouth and you're stabilizing the pH very, very quickly. You don't need mouthwash for that. Water, good quality water will do that.
You quickly mentioned a saltwater wash. Is that ever a good idea for people? It sounded like it wasn't, but I'm picturing somebody with canker sores or some kind of, gum bleeding. I could picture in those cases, probably other cases like that using a saltwater wash would be helpful.
Absolutely. I recommend it. I recommend a super saturated solution of salt water. Pick the highest quality salt you can. I like the salt from England because it doesn't have microplastics in it. Himalayan salt does. It's called Waldron. I can't remember. But anyway, delightful salt. Stir that into 8 ounces of water until you can no longer dissolve it. You still see crystals on the bottom. That means it's super saturated. Swish with it. If you have canker sores, as you said, if you're healing after some surgery, again, talk to your dentist about this. You don't want to really swish a lot. You could cause a dry socket after wisdom teeth surgery. But salt water is wonderful. It's a very hypertonic solution, and it promotes healing. If you have any epithelial damage in the mouth and you need epithelial regrowth, laying in of new tissue, salt water is a good thing. And even if you want to use it, there's nothing wrong with using it daily.
Okay. So it's not having a negative impact on the microbiome in the mouth?
Not at all. Baking soda, I'm a big fan of baking soda. It neutralizes things very, very quickly, but I wouldn't use it every day. There could be some interaction between baking soda and remineralization. So, baking soda and toothpaste is probably questionable as well. I haven't completed all my research on that, but there are some signs that could be interfering with remineralization.
You mentioned this rebrand on surfactants. It sounds like in the natural toothpaste. What is that term we're looking out for now?
Well, the SLS was the term for a long time, sodium lauryl sulfate. Now they have coconut-derived versions of it. On our website, we have a list of, from what we've seen, and we keep having to update it because they keep changing the name. It's like BPA-free. Then they just add something else that's just as bad as BPA, and you can't pronounce the name. So it's it's hard to keep track of this stuff. And there are some brands that say they are emulsifier free and surfactant free, and they just added something that is different. So that's a hard thing to deal with and to watch. But we do have a list of all the names. I think it's 50 or 60 different names. There's so much to worry about and to look at before you buy toothpaste and label reading and all of that. I really feel bad for the consumer. There's a lot of misinformation out there, and people are confused. They really just want the best product, and they don't even mind. They're not that price conscious. They just want to know that for the time that they're investing. And these are parents that don't have a lot of time. They're working. They've got kids. It could be a caregiver. I mean, that's brushing her mom's teeth with Alzheimer's. They just want to know that they are doing the best they possibly can, and that it's safe, and that it is efficacious, or it has a therapeutic effect. And unfortunately, there are a lot of chemicals put into toothpaste. Toothpaste is an imperfect product by definition. I mean, to make a paste of the things that you want in the mouth, they've added all these other chemicals and substances to help keep the paste stable and consistent. It's tough. Anyway, it's really look out for those. Don't underestimate the effect of a surfactant or emulsifier. And again, if your toothpaste is foaming, that's a bad sign. Even if they say it's emulsifier free, they have an emulsifier in there, and you don't need foaming toothpaste. In fact, there have been ad campaigns decades ago on how my toothpaste foams and how wonderful that is. It's not. It's just a byproduct of something that they put in there, and they didn't want to alarm the end user, so they said foaming is good.
When you talked about floss, you mentioned silk floss, and then this other new flosser. I'm assuming that's the slate flosser you were raving about last time you were on the show.
Yes.
I think at that point you'd only been playing around with it for about 4 months, but you're raving about it. That's still something you're loving?
I wish I had invented it. It makes so much sense. I mean, every dentist that knows, that has done gum work, I mean, we all have, they understand the architecture of the embrasure and the caul and the way tissue forms a papillae in between teeth. I mean, this is a very intricate, very unique part of the body. So much can go wrong. So much gets done correctly by the body if we eat the right diet, of course, and treat it well. And this flosser, and I hesitate using the word flosser because it's so much more. It's a flosser plus or a super duper flosser, whatever. It does flossing really well, and it makes it easier. It electrifies it. It vibrates inside the sulcus. But those little gum sweeps, they call them, it's like a little triangular piece of silicone with little hairs on it. As you guide those through into the embrasure, it's like a silicone shovel, triangular. It's not even a shovel. It's kind of like a scoop that literally, if you use it correctly, and they have videos online, you're literally in one sweep pulling out so much more than if you had just used floss. And I always tell people, use floss, then use the slate flosser. Look carefully, get your glasses on in a well-lit room. You will be amazed what the slate flosser is pulling out after you have done your normal flossing. So yes, I'm still a big fan.
All right. At this point, we'll move on beyond general oral care. Like we said before, we got into the nuances last time and talked about what bristles are made out of, the contour on the end of bristles. We got really deep. So yeah. I want to move into some more peripheral, controversial areas of dentistry. First one being amalgams. So let's say somebody at this point already has amalgams in their mouth, and they're wondering, best course of action, is it worth taking them out at this point now that they're already in? Let's start off talking about amalgams in general, and then we'll move into different cases that people might be in where they're either thinking about getting them or they already have them in their mouth and safe removal.
Yeah, many aspects that need to be discussed here. Let's start with a child. No cavities. Do not let the dentist put in a metal filling. And we use the word metal, we use the word amalgam, silver fillings. They're all the same. They're half mercury and half silver, and they add other alloys in there. Again, fabulous material for dentistry. It's been around for almost a century. It was very dangerous for dentists. In the old days, we used to make it ourselves, and then we would be poisoned, neurologically poisoned. A lot of the staph, it was typically the staph that got poisoned. There are vapors released from it. Now it comes in a capsule form. It's auto-mixed. It's never really exposed. The free mercury is never in volatile form exposed in the operatory until it's mixed. Theoretically, when it's mixed, it's combined with the silver, and you open the capsule and you place it. The reason dentistry loves silver fillings is because it's so easy to use. You got a hole in a tooth, in a wet mouth. You blow a little air on the tooth, and you just condense this material in there with a little plugger, and you can shape it. It hardens. It's strong. Over time, as it oxidizes and starts breaking down, where the edge of the filling meets the edge of the tooth, that's where the bacteria start coming in and creating another cavity. We call that recurrent decay. The oxidation byproducts of the filling actually keep those bacteria at bay. So even though the filling is failing over time, it's still keeping itself and keeping that joint or that union of two different materials, one biological and one artificial. It's keeping it clean. So unfortunately, it has a neurotoxin in it. So again, if you have children, stick with resin fillings. Resin fillings do have BPA in it. There's actually two available. I'm not aware of the other one, but there's one that it's from Germany that I do recommend, and it is BPA free and this GMA free and free of many things that you don't want your children exposed to. So I can give you the link for that. Just have your dentist buy that. It can be used as a sealant as well. But don't go down that road. Metal fillings are a little cheaper. I would say half the dentists in the US, probably Canada as well, are still using metal fillings. So it's quite prevalent. And that's not to be confused with aluminum crowns. Those are aluminum. That's a different story, not necessarily a neurotoxin. So first case is don't go down that road. Now, like you and me, maybe I'm misspeaking for you, but most people have metal fillings in their mouth. And I had mine taken out. It took some time. I did it very carefully. I replaced most of them with gold. We can talk about that later. But you can have them replaced with composite. I waited until I found someone that could do it correctly, because the time that the patient is mostly exposed, and the provider and the operator, the clinician and the auxiliary, the time that the biggest exposure is placing the metal filling and removing it. So it really has to be done properly. I'll give you the link for this, IAOMT, somewhere in the Midwest. They have the best protocol for removing. It's called the SMART method, SMART. And you can go to their website, find someone that has that training and have it done that way. Now, having said that, is that something you want to jump on right away? No. So again, it's like remodeling a house. You want to have a master plan. So you have to know, first of all, if your fillings are doing well, maybe leave them in there for now. You can also have your exposure to mercury measured. The best test is out of Denver. It's called the Quicksilver test. It's a test, urine, hair, and blood. And you can measure for the amount of mercury that you have in your system. If it's low, you may not want to mess with it until the filling fails. New fillings are expensive. You can delay that. But back to that remodeling metaphor, you don't want to just keep fixing a countertop or a dry rot in a bathroom. You want to have a master plan, because you may have to redo those fillings if you have bigger issues, or maybe you need a crown. Maybe the tooth is not savable. Just make sure. I see this a lot. Knee-jerk response. Patient walks in. I used to get this all the time. I want them all out. And I knew exactly what they meant. It wasn't their teeth. It was the metal fillings. And then I would try and incorporate that into a well thought out plan over time, get it done safely, and take away the panic aspect of it, and get them tested as well. And because you can get into a lot of trouble. So a lot of people are going to their dental offices. They're saying, take them all out. It gets done all in 1 or 2 visits. It's not being done properly. And they just inhaled a lot of mercury. And then now they have more mercury in their system because of that knee-jerk response. So that's if you already have them. There are a lot of other smaller questions, like can you leave them underneath a crown? Does it leach through the tooth into the pulp? Are there safer versions of amalgam? No. I would at some point in time have a plan that is feasible and is done sequenced correctly. Try and get them taken out, but only before you know how much mercury you have in your system. And if you're high in mercury, that's likely the source of being high in mercury. That would be a good time to act. If you're really low in mercury, then you're kind of what's that called? When you kind of stir the pot, you're just, you could make things worse. And then obviously test afterwards. Make sure that the process itself didn't expose you to a lot of mercury. So you really have to be in the hands of a very talented dentist, not just clinically, but in terms of how you address the exposure during and after, and how you chelate it, and there are dentists that can do that. So what I think my point is that you have metal fillings, no knee jerk response. Don't get them all out right away, and make sure you've picked the right person. And not every dentist. There are only a fraction of dentists that do it properly.
Okay, you mentioned this product from Germany that is safe or safer. You talked about the fact that when you had yours removed, you went to gold. I also know there's ceramic. Let's talk about all the different quote unquote safe options, and then how does somebody pick the best for them?
Right. Zirconia, high quality gold. We call it high noble gold. There are other lower qualities of gold with a lot of alloys in them that you don't want. We've got metal fillings, of course. We're not going to talk about that as an option. And then there are the composites, the ceramics, the plastic fillings, all the same category. Those are put in with resins. Sometimes we use acetone to help clean the tooth. They are more technique sensitive. They have to be used sometimes with a rubber dam, a lot of isolation. And again, that's the advantage of the alloy. Any poorly trained dentist in the old days, it was just non-trained. They would just take alloy and just stuff it in there because it works and it would last and it's resistant to moisture and all that. But composites have to be put in with a dry field. They have to be layered sometimes. There's beveling. You can't just cut a hole. It's there, and that's why they cost a little bit more. But insurance does cover typically 80% of the procedure. So, but you do want to use a safe product. The product that I've been recommending for a long time is the Admira Fusion out of Germany. There is one other product. I'll try and get you that link as well. But again, that's the minority of products. The majority of products out there are pretty toxic. If you had to pick between a toxic ceramic filling and a metal filling, I would choose the plastic filling. It's a terrible choice to have to make, but then we have, I'll save gold for last because it's really one of the oldest and best materials in the mouth, believe it or not. But it's going to be hard to find someone to place it properly. Zirconia. So first we had porcelain, and that was just glass, and it was stacked, and there was a mechanical locking to a low noble or a base metal, and we've steered clear from that. They don't look very nice, and so now we have a pure ceramic product. It's called zirconia. You can make implants. Implants are made out of zirconia. Good alternative to titanium implants. Pretty inert, pretty strong. Slight risk of fracturing. You need more thickness, which means more reduction of the tooth to provide resistance to that. But zirconia is incredibly strong. In fact, many zirconia crowns will break, and then the other part of the crown is still hanging on and can for years. Where in the old days, when porcelain broke, it would just start crumbling and falling apart, and you'd have to act on it right away. So zirconia is pretty safe. One caveat on zirconia is that if the dentist is doing a lot of grinding on the zirconia crown to get it to fit properly, make sure they're doing that grinding elsewhere near a hood, a ventilated hood, or everyone's wearing masks, or the room is well ventilated. I mean, there are several degrees of efficacy there. Breathing in zirconia is not a good idea. So, and dentists do have a higher incidence of lung irritation and issues if they're not taking precautions because they're around it all day long. The patient is not. They're just there for that 1 or 2 or 3 visits in their lifetime. But again, I'm paranoid about these things, and if there's a way to prevent something, I'm going to point it out, or behave in a way where I can prevent that. So zirconia is a great material. Veneers, crowns, implants. It's a real boon for the industry. It's strong. It's reliable. It looks good. It has great high aesthetic value in the hands of a gifted cosmetic dentist. So not a bad material. Pretty inert. The only caveat there would be the grinding in the operatory to make it fit. And then how well can it be polished afterwards? Typically, if there's a lot of grinding going on, the crown doesn't fit, it's probably time to make a new one. Or if it does get ground and it fits nicely, it looks good, send it back to the lab and get it glazed, get it properly treated. The polishing that dentists do in the office isn't quite the same. This is probably more information than you want, but it is related to safety. And then gold, the gold standard, right? It fell out of favor. It was expensive, difficult to do, very technique sensitive. It is the high end, what I call the Formula One race program, and all those techniques. Even if you're not doing gold, the techniques of prepping a tooth to be conservative, to hide gold visibly from a forward view, build up techniques and saving tooth structure. Gold is a very, very conservative restoration, and it's soft. It wears at the same weight that enamel does. Zirconia does not wear at the same rate that enamel does. So eventually it becomes an island in the mouth. It can become it can sit a little bit high in the patient's bite. Enamel wears at 5, 6, 7 microns a year. That's normal. You want gold. You can. There's a Tucker gold. It's named after a famous gold technician. It wears at exactly that same rate. It's designed to wear at the same rate that other teeth do. Thermally, in terms of expansion and contraction, these are all coefficients that dentists are very concerned about. It is a very friendly material. The one drawback, maybe there are 2 drawbacks, but the one drawback for most patients is cosmetics. My wife has gold inlays. Nobody ever notices them. You can hide them. In certain areas, it's the way to go. You don't have to put in a composite. You can go right from a metal filling to a gold filling, and chances are that gold filling will be the last thing you ever do to that tooth. That's how long gold lasts. Does it cost a little bit more? It's the same cost. It's an indirect method where you have to take an impression, send it to a lab. So it's the same as a crown. You can do gold crowns as well. They last, and they don't leach anything into the body. They're very biocompatible. Finding a dentist to do it is difficult. I can give you a list of dentists. It's still, again, it's the race program. I was in it for over 10 years. Probably the most fun and the most difficult learning experiences I've ever had in dentistry. And again, you bring in your own patients. In the morning, you work on your patient with another dentist, and then you swap. All of your work gets projected up on a high resolution screen, and they pick away at it. It is an amazing restoration, and it is still in use. It's all over the world. Japan, Germany is big on it. The Netherlands. There are these Tucker study clubs all over the world. They're in Canada. In fact, they're very big on the West Coast in Canada. He's Dick Tucker. It's not with us, unfortunately, anymore. Richard Tucker was an amazing man, but his son is still keeping it going. And then the beauty of that Tucker method is it's not just the dental work and the clinician's work. It is the communication of the clinician and the work of the lab person who's making the gold. It's that relationship that I've never seen so intimate and so functional and ever in any process in dentistry. That is what all the training is about. So that would be the very high end, and you don't hear that being talked about very often, do you? Gold.
What about gum health? For somebody that is having their gums starting to recede a little bit, maybe they're having some bleeding when they're flossing or brushing, how much of that can be repaired and, for lack of a better word, grown back with proper dental care like we're talking about today?
Right. So specifically, to answer your question about gum recession, this is a big problem. Let's back up a little bit, though. So gum recession has many different causes. The one that doesn't get discussed often enough, or is not in the thinking of the patient probably because we're not discussing it enough, is that most gum recession comes from gum disease. So if you have inflammation of the gums, bleeding when you spit in the sink, or you see a little blood on your toothbrush, that's not normal. If you saw blood on your forearm every morning, you would say that's not normal. You would probably have it looked at, probably skin cancer, right? Or, something else. What happens there is that the body, in trying to fix the gum disease, it's killing off the edge of the gum. It's trying to wall itself off. So it's dying, it's necrosing. And as that free margin, the gum line, recedes and the body is trying to fix itself with all that inflammation, it's essentially a cytokine response. There are some autoimmune aspects of it as well. It's a chronic disease, but even in its acute phase, the body's trying to heal itself by necrosing that layer of inflammation. The inflammation starts at the free margin, which is right at the edge of the gum line. You can get in there and overbrush. You can be too aggressive. You can eat certain foods that cause mucogingival issues, which is related to severe gum recession. And if there's gum recession, then there's bone recession. And then if you lack bone around the tooth, the tooth starts wiggling, you lose the girdle of bone around the tooth, you get recession, ultimately leads to loss of the tooth. So there's certain foods. You can bite on sourdough bread, for example, the crust, oat bran for some reason. That's written in a textbook, on the textbook on mucogingival issues, which is gum recession. There are genetic predilections to it. If you're of Northern European ancestry, you're more likely to have gum recession. It can be tongue ties, lip ties, frenum pulls. So there are many reasons, but it's typically inflammation. Chronic inflammation leads to recession. And so the gum recedes in response to all these things. It's usually a combination of all the above or some of the above. And then the patient starts getting very sensitive teeth because the root of the tooth is exposed. And the root is very porous. It's only 50% calcified, where the enamel is like glass. It's almost 100% calcified. Two different structures. And on the other side of that porosity is the nerve, and the nerve can sense things like cold, abrasion, certain foods, that kind of thing. And it can be quite painful. For one tooth to hurt, okay. For all the teeth to hurt, or if there's a lot of recession, and it's a very low grade chronic kind of pain. And so tooth sensitivity due to gum recession is impressive and is not to be looked at lightly. So big question we always get is, can we just grow back the gums? And the answer is complicated. Right off the bat, I would say it's very difficult. Keep what you have. Don't let it get so bad where you start losing gum tissue. You can go through very complex surgeries, connective tissue grafts, free marginal grafts, free gingival grafts. You can take grafts from the palate and stitch it into the gums. Very technique sensitive. Very few clinicians do it properly. Also, there's a pinhole technique. That's something new. That works, but that's based on case selection. It has to be a perfect case, and the provider has to make sure it's the right person, the right place, and for it to work. Overbrushing, eating the right foods, chewing properly, these are all things that have to be addressed. And then maybe after a lot of money and a lot of time, and there's no point in doing these surgeries if you have the inflammation, for example, because it's just going to continue. And then there's some gum recession with aging. You can have perfectly healthy gums. You've never had any inflammation in your life, and you've bitten on a few things just wrong, a potato chip, a sourdough crust. You feel that scraping on the side, you can get a wound. It may not heal back properly. You do want to, the best thing to do for gum recession is just never let it happen to you on a big scale. Prevent it from happening. It's crowding of the teeth can cause that. There are other issues as well. Trauma, certainly. If you get hit in the face, baseball to the face, surgery, orthodontic surgery. I just had an influencer reach out to me, and she sent her x-rays to me, and the dentist found all these dark spots on a cone beam x-ray, and they were not infections. It was a result of bone loss and gum recession due to orthodontic surgery, where they cut the jaws and move them to make the bite better. So be very careful. Make sure you're really working with someone that understands gum recession in its totality. It's not just brushing. It's not just grinding. Grinding can cause recession as well. So I don't know if I answered the question well enough, but it's very complicated. But the answer is, once you have gum recession, it's hard to get it back.
Well, I'll throw the question back at you that you get from patients. You mentioned the fact that they want to know, can I grow it back? Specifically, if we're doing all the things we're talking about today and taking great care of our oral health, how often do you see any regrowth of the gums?
0.
Okay.
Yeah. Sorry. The tissue isn't, it's not like a cornea or oral mucosa tissue that can grow back. It's I mean, on a microscopic scale in some instances, but full on gum recession, if you have a millimeter of gum recession, you're never going to get that back unless you have surgery. It will not grow back to that height again. And even after surgery, it's never quite what the patient wants in terms of aesthetics. Dentists look at it a little differently. There's what we call attached gingiva, and we need a certain amount of that. If that shrinks to below less than 3 millimeters, the tissue starts pulling down.
All right.
It's complicated. I wish I could, have a IMAX camera in someone's mouth and show everyone, all the details. But the answer that I hate giving, because it's very negative, is no.
You got to be preventative. Okay. You mentioned the fact that when we start to get recession, the roots of the teeth get exposed and they can become sensitive. For somebody that starts brushing with a toothpaste like yours, FYGG, or another one that has the micro and nano hydroxyapatite, do you ever find that becomes part of that exposed area if you're brushing with that for a prolonged period of time, say 6 months, a year, and some of that sensitivity can come down?
Well, nanohydroxyapatite is probably the best thing out there for dental tubular decalcifications, which is essentially that porosity that I was talking about. And you really want to occlude or block those tubules. We've got, we used to have Denquel, Sensodyne. They used, I think it was pyrophosphates. We had fluoride to obturate and fill those tubules. But the nanohydroxyapatite, which is a smaller version of what's in the tooth to begin with, it's biomimetic. It's just the right size, and it has the right negative or the right electrical charge. And so when the tooth sees it, it just gets drawn in there. It penetrates the tubule and it blocks it, and it armor plates it. So that works well, but then you can lose some of it. Again, you can start drinking electrolytes at pH 2.4. That will leach some of it out. If it was normal calcium that the body had put there on its own, and there was no hydroxyapatite toothpaste in the equation, it would also happen. That is just the normal course of how things work. So to properly maintain the health and the porosity and the sensation you get from exposed dentin, it's more than just using the right product. I mean, you have to be careful. When I was using that electrolyte, it really brought it on within 3 days. So mouth breathing, low saliva, all those things. So you really have to address it from all aspects. But if you are in a lot of pain and you want to take it down real quickly, sometimes even in 1 day, a good nanohydroxyapatite toothpaste with the right particle size, right particle shape, uncoated, and the right, at least, I would say at least 1 to 3% of nanohydroxyapatite in the toothpaste. You can get more if you want. It doesn't necessarily help. You can use a varnish. You can add prebiotics to it, and L-arginine and other things that help remineralization, but you got to keep your mouth moist. you got to stay away from this very acidic products. And most people figure this out on their own. They know if they go out on the weekend and they're drinking a lot of wine and eating stuff that is acidic and coffee in the morning, they start feeling it, and then they know, okay, I got to back off. And then they go back to their normal routine and they're fine.
All right. So it can work, but it's part of a bigger picture. You can't just put that on and ignore everything we're talking about.
Well said. Yeah. It's not the magic silver bullet.
Let's move into root canals. This is an area in the natural health world, a lot of fear around it, a lot of horror stories. Let's start out talking about what they are and when somebody typically would get one.
Yeah, there is a lot of, and I think you used the right word, terror when it comes to, and fear mongering. And I mean, I would much prefer not to have a root canal. But then again, if you say no to the root canal, then you're missing the tooth. New study just broke the other day. You can almost correlate the number of missing teeth to how soon and how bad your rheumatoid arthritis will be. I mean, it's you don't live as long when you start losing teeth. Probably has something to do with digestion and processing of food in the mouth before it gets to the gut and the colons, the colon and the large intestine. So, root canals. You're kind of damned if you do, damned if you don't. And as a practitioner, whatever you say, people are just going to, it's as emotional as the fluoride debate. It's almost as emotional about the nanohydroxyapatite. Boy, that's a new debate in dentistry. So let me just give you the best advice that I can give you. Okay. I've done a lot of root canals in my career. The methodology has changed. It's gotten much better. I do agree. I agree with the anti-root canal people. And again, it's based on one book from the 40s. It kind of started with that. There's a dentist in Oregon that says, take them all out, put in implants. That's the basis for his business. It's a bit much. He has lots of good before and afters and horror stories and all that. But the majority of stories are fabulous. So starting about 15 years ago, I started taking CRP blood tests on all of my patients, or if they already had them as a baseline, and then I would take them after the root canal and then over time. So, and what that does is it measures the inflammatory response. If the body's fighting an infection, that CRP will elevate. There are other tests too. There's another test, platelets and all that, and white blood cells. But because I was curious, and so the gist of it is a well-done root canal will remove enough bacteria and prevent them from recolonizing in this interior space of the tooth. This is, you come in from the top of the tooth, you drill a small hole, smaller the better. We call that the access point. And if you drill too big, then you've weakened the tooth. It may crack, even with a crown on it or a filling. Small hole, you get to however many pulp chambers there are, and you remove the blood vessels and the nerve tissue and the pulpal tissue, which is a mesenchymal tissue. It's the tissue that helped form the tooth. And it's there for a good part of your life. Now, as you get older, the tooth internally calcifies, and a lot of people will have teeth that will lose sensation and are non-vital because that tissue is lost. People that grind their teeth a lot, that process is hastened. But anyway, that tissue could be inflamed or infected. We call it hyperemic pulp or irreversible pulpitis. Pulpitis is a swelling of the pulp. And what causes that? A cracked tooth, trauma to the tooth, bacteria getting to the tooth via a cavity, many possible reasons. Poor dentistry is a big cause for teeth needing root canals. But anyway, the pulp gets irritated. The host is in a lot of pain. Spontaneous pain, hot and cold, pain to hot and cold. There's lingering pain. So really you want to get pulp tested. There is this progression of reversible pulpitis to the point where you cross over to irreversible pulpitis. Reversible pulpitis sometimes is misconstrued as irreversible pulpitis, and the dentist goes in there and he also wants to get the patient out of pain because reversible pulpitis is very painful. But there's a chance that the tooth can heal itself given the right treatment and anti-inflammatories and maybe remove the insult, whatever it may be. It doesn't always happen though, but it's very difficult to know in what state that tooth is. So get the tooth pulp tested. Don't say I don't want a root canal, because the alternatives are expensive and difficult as well. And implants are not perfect and have similar issues as do root canals in terms of post-op infections and seeding the rest of the body with bacteria. So if the root canal is done properly, and these days that's with a massive microscope that sits in the corner of the room on wheels, and it's usually made by Zeiss, and it's rolled over, and the endodontist is looking through that. They're using lasers. They're using ozone. They have more control and command of removal, cleaning, debridement, and then filling and sealing off that chamber. And again, the fill and seal is only to the tip of the root. And once that's all cleaned out, that tooth, the body still is clinging to the tooth via fibers, periodontal ligaments. And the body can do well with that. Now, every few years, I would test that tooth. I'd get a 3D image. If it's tender to percussion, if there's some referred pain at any time during the existence of that root canal, you don't want to leave a poorly done or a failed root canal. And that's where the horror stories come. And again, it's a small percentage. I would say it's smaller than the horror stories for wisdom teeth. A failed root canal is a big deal. It can take you down. It can seed your blood vessels and other organs, including the brain, possibly even a fetus, with some bad stuff, bugs, and can kill you, possibly. Very, very rare. But so can gum disease. So can other oral infections as well. So that's where the horror stories come from. And unfortunately, there are a lot of poorly done root canals. They're done very quickly. Dentists love it because 80% is covered by the third party, and root canals are expensive. So every time a dentist sits down and does a root canal, he's getting paid $800-900, and they try and do it in one visit. Do a root canal in several visits. Especially if it's a hot tooth, if it's painful, if it's had a lot of inflammation. Don't jump right to it. Make sure that it is pulp tested properly. And when you do get the treatment done, get it done properly. Make sure your dentist is, and I can give you a list of a few if you want. There are not many that use the very, very high-end laser ozone techniques, but they're growing. And the specialty of endodontics, the root canal specialist, has risen to the occasion to making this better. But people have lived with root canals for a long time. A woman who has a root canal here does not get breast cancer on this side. These are all myths. Can you get cancer from a root canal? Yes, but it's not on the same side. I mean, that's not how the body works. You can get other cancers. That is from a leaky root canal that has been ignored, that is failing, that has an unfilled canal that the provider missed. Anyway, so, and the alternative is you can't just take the tooth out and leave it empty, leave that area edentulous, because that leads to problems as well. Your bite will change. You'll start getting TMJ, and then another tooth, you'll lose another tooth, and that's not a good thing as well. So again, there's always a more nuanced version of the fear mongering that you see online, unfortunately. And so that's, you got to maintain that tooth. You got to watch it. If it does fail, jump on it. Get your CRP measured. I get mine measured every year. Just want to know, is my body fighting something? And if it is, then I'll fix it, find out what the root cause is. Could be a root canal, right? Maybe. And then deal with it, and then measure again until your CRP is low again. This is how you have to do it. You have to do it based on the data, not the hype and not the fear.
It's a lot of work taking care of this mouth.
It is. And it is a lot of work. But I don't think anyone should be surprised, and it should be part of medicine. And then people complain about their dental bills. I mean, think about it. People spend more on a haircut than they do on a dental cleaning. And do you know what the setup is and the overhead is what the hygienist has to be paid, to do the job properly, and then what happens on the back end, sterilizing instruments and providing a safe operatory that is clean. I mean, haircut stylists, it's just a room with a special chair and some scissors. And I'm not, that's a very important skill. I'm getting my haircut. I have to be careful in a few days. So it's just if you're getting charged $110, $120 for a cleaning, I mean, please give me a break. That is one of the best things you can do, for your overall health. And so the mouth is a lot of work, but think about it. Look where the mouth is. Look what's going into the mouth. Look what the mouth is sampling. Look, you're breathing, you're chewing, you're trying to maintain the only inanimate object that pierces out of the body. The fingernail doesn't count. That's something different. The teeth, this inanimate object that you're trying to keep the rest of the body clean. What happens in the mouth can spread to the rest of the body. You're sampling the environment through your nose and your mouth. I mean, you're smiling, you're communicating. I mean, you're beginning it's the opening to the digestive tract. It's the beginning of digestion. You're making sure you're not taking in any bad foods or poisons. The mouth is an integral part of the body, and it's very important. And yes, it does need a lot of maintenance.
Yeah, no, I'm not saying it's not worth it. It definitely is. It's just making people aware of the complexity of the mouth and everything connected to it, which is the whole body when you get down to the root of this. And just understanding what it is and how to properly take care of it. Because for a lot of people, it's just brush twice a day, floss once a day, go get your teeth checked out by your dentist maybe 1 or 2 times a year, and maybe nuke the bacteria in your mouth with some mouthwash every day. And it's like, there's a lot more to it. And it's
not just a bunch of teeth in there.
You need to get fascinated by it and to embrace it, because it's a lot of work.
It is.
You mentioned wisdom teeth there. Let's talk about why those are such a quote unquote issue for so many people. And then for somebody that needs to have them extracted, is there anything they should be mindful when it comes to the practitioner? Obviously, you want to find a good practitioner, but like, what is it that is the difference between having it done by somebody who's just, doing average work versus the best?
Yeah, important question to expand on. Very common. For everyone that's listening, think in the back of your mind, did you have your wisdom teeth taken out? I would say probably 90% of you have, and probably the other 8% needed to have them out, right? So why is that though? I mean, our ancestors didn't have oral surgeons. We didn't have that rite of passage at age 17, 18, or before you went to college or before you went off to war, where you had your wisdom teeth taken out. Well, there's a reason for it. And it goes back to the size of our jaw. And again, it's that last 1% of our the timeline. We've had a completely different environment, completely different diet in that last 1%, let's say the last 500 years. And because of that, we have to have our wisdom teeth taken out. So think of the jaw coming in, and it's growing in width, kind of a downward forward kind of growth. The upper jaw has to expand. The tongue is part of that equation. The tongue has to be in the right position. You can't have a tongue tie. You have to be eating solid foods, not this pureed baby food. Breastfeeding, a year or two of breastfeeding would have helped, because that helps with the tongue. And it's the muscles of the face that kind of shape the face as it grows. It's very malleable, but we're not growing correctly. We don't have those big jaw lines. We have V-shaped faces, pushed back faces. And because of that, the jaw is smaller. But guess what? The same number of teeth are coming in. If evolution was working perfectly, we would be, growing less teeth. And then we would just have smaller jaws that wouldn't really fix anything. But so the last teeth that come into the mouth, there's no room for them. It's like you're filling up a room in a storage locker, and then you open that storage locker one day and you've got 2 pieces of furniture in there, and you're like, oh my God, I'm going to have to rearrange everything in the storage locker to get these 2 big armoires in there. That's basically what happens at around between age 15 and 22. It can be a little bit later. It depends. But so what do? Do you take everything out of the storage locker and rearrange it? Do you throw out some furniture? This is what orthodontists do, and they do it after the fact, which is not the time to be doing it. We know that this happens. Why aren't we being more proactive? So that's kind of the why. So, and I can go down that rabbit hole all day long. It gets me all emotional. I mean, it's such a thing that really has been not forgotten, but overlooked in dentistry. But anyway, So we got the last teeth coming in. Upper two wisdom teeth, two lower wisdom teeth. It's the third molar. There are some people that are born with 4 molars, and there are some people that are born without third molars. Some people say you're more highly evolved if you don't have that third molar. That's hogwash. Those teeth come in and they have nowhere to go. So what do? They go sideways. They go out towards the jaw. They go into the roots of the tooth that has erupted already, that very important second molar. They can go sideways. They do try and erupt, but the jawbone is ascending already to the condyle, to the joint here. So it's sitting in bone. In the upper areas, they'll go into the sinus. They'll go sideways. They rotate. They will go into the sinus. They will go into the root structure of these teeth. They'll kill those teeth where you have to lose your second molar. When you take this tooth out and you wait too long, the upper wisdom tooth, that's what happened to me. Again, my parents, we weren't really able to afford a lot of dental care. It was just very basic. I didn't even go in for cleanings on a regular basis. And then when I got to dental school, I was 25 years old. They looked at my wisdom teeth. We took a Panorex, and it's like, oh, this guy would be great teaching moment right here. He's got impacted wisdom teeth, small jaw, everything. I'm like, oh, stay away. So I finally, third year of dentistry, actually, no, it took longer than that. I had to find a surgeon that could handle it. I was a difficult case because there was a worry of a perforation of the sinus. So anyway, so ideally, take those teeth out before they become difficult to remove. Take those teeth out before the time, if you do remove them, you need a lot of bone fill to fix the defect or the space. We're talking about cavitations here. And also it's easier for the patient. So I had mine out late in life, and it took me 8 years to find the right surgeon. He did an incredible job. Had to go back a few times. I've never seen him sweat in my life. This guy is so talented. He's still practicing. And he, to this day, I'd refer him a lot of patients. He was actually right next door, ironically. To this day, he always tells my patients, oh, Burhenne, yeah, that was my most difficult case for just regular wisdom teeth removal. And they're like, whoa, that's crazy. Anyway, get them out when they're little round balls, little marbles, no root structure, and they roll out. The patient's young, they heal well. The only problem with that is young patients don't take post-op instructions very well. So make sure you get the post-op instructions to the parent, and deal with it then, because the jaw may not grow to its full potential. Typically, it doesn't. You can intervene between the ages of 2 and 7 or 8 and expand the jaw in hopes that you can fix that. And that is possible. And then maybe there is room for the wisdom teeth, but don't wait too long. A lot of patients are like, oh, it'll fix itself. It won't. And it always happens at the worst possible time. This is why when you join the Army, they take out your wisdom teeth, because you're out there in an M1 and Abrams tank, and all of a sudden you're incapacitated, or you're a pilot, or you're, flying a bomber, and you just, that's how bad wisdom tooth pain is. So typically it's done before you go to college, because in college you're kind of at the mercy of whoever is available. You're not home with your parents, and then you recover from the surgery in a dorm with, in a fraternity. Here, gargle with this beer. This will help. So anyway, it's something that unfortunately needs to be done often. So find the right surgeon. You heard my story, right? I would do an oral surgeon. They're set up for it. They do it all day long. This is all they do. Ask them, what is their incidence of nerve damage? I think it's a fair question to ask, and it should be 0.1%. It's a little high, but ask them that question, because that's one of the if you wait too long and you are aggressively have to remove that lower wisdom tooth, you can damage the lingual nerve to the tongue. It typically repairs itself, but not always. So make sure you're using the right guy. Make sure on our website, we have a blog post on what to do before and after. It's quite a long blog post, and what to buy, and Amazon links on what to prepare for, what to drink, what not to eat before, how to keep your head elevated. That's a big one. That surgeons never tell you that. Don't lie down flat afterwards. You're going to get a lot of pooling blood and a lot of inflammation. Get one of those wedge pillows. Stay elevated for 2 or 3 nights. That helps a lot. Use ice. But anyway, it's an unfortunate necessary evil in our society today. And you don't want to be one of those people that says, that's not going to happen to me. Or my favorite is, that's just a big scam that dentists do. It's not. Blame big food if you want to blame someone, agriculture, lifestyle, whatever. But don't blame dentistry. We're doing the right thing.
For somebody that's tuned in to what we're talking about today, and they're able to breastfeed and do all the things with the child right from when they're born, did they have a chance? You mentioned the palate expansion, but that's obviously an intervention. How often would you guess somebody that's living a natural lifestyle, doing the things we're talking about today, is going to have a normal palate? Or is it just the de-evolution to this point and we're just basically all screwed?
That's a really good question. And the answer is we really don't know. There is some de-evolution going on. There is probably some genetics at play here. But let me tell you a little story. One of my favorite dental stories. So I had a patient once. It was a family that just recently immigrated from Eritrea, which is near Ethiopia in Africa. Lovely family, amazing. He ended up being an engineer at one of the big chip companies in the Silicon Valley, and she brought in her kids, 2 kids, 2 boys. And the first time I met them, there was a little bit of a language barrier, and they were very respectful of the professional environment. Again, that's it's where they come from. And it was kind of like, you do whatever you need to do. He was a 4.5-year-old boy. And the minute I met him, he just jumped in the chair and he opened his mouth. And I'm not used to that, of course. Most American kids are, they're defiant, and they're usually protective of this because they can't breathe through their nose. So of course they're going to protect this. They don't want hands in there and fluid and water and rubber dams and all that, because that's their main airway. And then mom's there and they can complain, and then mom comes over, and every dentist knows what I'm talking about. But anyway, this boy was wonderful. And so I brought down the chair and I asked the mom some questions. I wasn't able to get a lot of information, but my first impression was, this young boy has the most beautiful smile I've ever seen. I mean, it was at first I didn't know what to identify that made it beautiful. I mean, I had to look at him first, but it literally knocked me over. Beautiful white teeth. Usually, the teeth are a little yellower at that age, and it was broad, perfect lip line. His mouth was closed the whole appointment, except when he was speaking or when I was examining him. Beautiful facial structure. So as I got to know him, I was looking at his tongue and the position of his tongue and the width of his arch and all that. And so at the end of the appointment, and again, he was not fearful. There was no fear at all, no anxiety, smiling, and he was able to keep his mouth open. He was breathing through his nose. So to make a potentially longer story here shorter, when he jumped out of the chair, he ran over to his mom, kind of jumped on her lap, leaned back, pulled up her sweater, and latched on. He was still breastfeeding. He had just come from Eritrea, so he hadn't been eating junk food. Later, from the dad, who was the English speaker in the family, I found out that he was eating raw meat, not sticks, but raw tenderized meat that was dried on lines. He was eating a lot of like beans, no rice, no grains. What else? There was something else. There was some kind of curd that they were eating, and they weren't eating a lot. But this was a healthy young man. So over the years, by the time he turned 14, 15, and then later 18, 19, his wisdom teeth came in, And usually, even if wisdom teeth come in, there's still a bunch of tissue on the back end where you can get pericoronitis, which is a slight swelling of that gum tissue, or the tissue sits high. He had, and Dennis will appreciate this, he had about the clinical crown of the distal part, the back part of the tooth was completely exposed. In other words, the tissue was right at the where the enamel ends and the root, the DEJ, where the root portion starts. I had never seen anything like that. But again, he didn't grow up in the U.S. He didn't have the diet of what we have here. I would talk to the parents about what they were eating, and he would bring in his lunch sometimes, and it wasn't a typical American lunch. There were never any bags to rip open or bars or anything like that. And he drank a lot of milk, and he developed properly. And so I guess the answer is that in today's world, you can still see that. When we go back to studies where we can excavate 800 perfectly fit young men that were buried after they built a pyramid in Egypt. That's 4,000 or 5,000 years ago. We look at their jaws and they're amazing. They're perfect. Everyone had room for wisdom teeth. There was a little wear on the teeth. There was some grinding, probably grains that were milled in stone, little particles of stone, abrasive diet maybe, but incredible wide arches, no crowding. We could see the teeth, obviously. We could see the jaw. We could actually measure what their diet was based on the DNA that was in calculus on the back of their teeth. Amazing. So it's still possible today, but the answer is it's not the norm, unfortunately.
You mentioned cavitations. This is something that's often talked about in the natural health realm, where somebody like me or you gets tuned into this later on after they've already had their wisdom teeth out years ago, and having a special cone beam, I think it's called like a cone beam x-ray, to see if there's inflammation and an issue where the wisdom teeth were taken out years ago. Talk about how common that is and what exactly is happening there.
Right. So again, very controversial. I'm not saying that cavitations don't occur and exist. They do. I've seen them. But there are a lot of dentists that they have a cavitation business, and they take an x-ray and they see a radiolucency or a space, and they ask, did you have a wisdom tooth there? Was it removed? How was it done? Oh, okay. Well, it's probably has an epithelial lining. So if there's a space in the bone, like a hollow piece of the jawbone, and if it's growing, and if it does have an epithelial lining and there's an infection, then that is a cavitation. It has to be removed. It has to be scraped. It has to be filled in with bone, grafted. But how often does that happen? Not very often. So if the extraction is done properly, you don't see it often. There are a lot of extractions being done improperly, being done too quickly. They're leaving scar tissue in there. They're not curetting out the socket. They're not handling it properly. And even then, the cavitation never occurs. But cavitations do occur. So if you do see, a lot of people are looking for that magic bullet, like I'm sick, I'm continually sick, my joints hurt, my CRP is elevated, I don't have a lot of energy. These are patients I come across a lot. And they say, I think it's my cavitation. Can you just take care of it? And I say no. I say there's a lot more to deciding whether if it is the cavitation. Let's do a complete health history. Let me speak with your physician. Let's find out what the root cause is, and let's look at your CRP. When did it elevate in relationship to when did the symptoms start in relationship to the surgery? There's usually a delay there. It's very complex, and there's no rubber stamp for it. So if you think you have a cavitation, and you should see the right person, but the right person may be, you may pick them up online because they're a cavitation expert. Well, if that's all they do, I'm not saying that's bad, but be careful because, if you have a hammer, everything that's going to look like a nail or whatever that expression is, a little bit of that is true. And I'm thinking of one person here in the US that bases his whole Instagram presence on this. So it's not as common as you would think. But it can happen, and it would have to be dealt with properly. And a general dentist typically is not set up for this. And remember, it wasn't too long ago that dentists that really pushed this agenda would lose their licenses. And so it's a fine line. It has to be scientific. Get it biopsied, Make sure there is an infection. Make sure that you are fighting an infection. There are many ways of systemically testing for that. If that's not being done, then and you're just basing it on an image, go see someone else, get a second opinion. I'm not saying that it isn't a cavitation based on the image, but that you need more information than that because it is a difficult surgery. It's expensive. And you would be very disappointed if your problems didn't go away after all that. Because sometimes you're just scraping a traumatic cyst, or a traumatic cyst is typically harmless. A lot of people are walking around with little cysts, but there's no epithelial lining. It comes from some sort of early trauma to the face. My wife had a traumatic cyst for a long time, never bothered her for 40, 50 years.
So a couple areas within the natural health realm that are more intricate, the story often told, are the root canals and cavitations. Any other topics like that within our world that people talk about that there may be more to the story like you shared in those two realms?
Right. You mean controversial areas
well,
of
just
dentistry? Or?
Those two areas have a lot of steam in the natural health world, and a lot of people have so much fear around both of them. And you've brought out more of a nuanced story around both of those areas. So I'm wondering if there's any other topics like that that you see time and time again in the natural health world, in the realm of oral care, that there's more to be told about that story that we're all fearing. And again, the root canals and the cavitations are both prime examples.
There are a few I can think of, maybe, that these may apply. One is occlusion and bite and how it relates to back pain, shoulder pain, posture, balance. And again, it's the same story. Yes, that can be the case. But it's very difficult to discern and to diagnose and then treat. Occlusion is very difficult, very three-dimensional, a very complex topic. The TMJ, TMD, the joint here and joint pain, there's a lot of monkey business going on in that area as well, unfortunately. And then also probably in the sleep world, in sleep dental medicine, which is now a category. And again, dentists can see sleep apnea well before a physician can, because we're looking at different things. So just because you're a bruxer doesn't mean you necessarily have a small airway, although that should alert the dentist right away that something is up. There's probably some form of sleep disorder breathing issue going on, especially in a child. It's not necessarily related to stress. So again, everything has to be nuanced, and you want a practitioner that looks at everything, big picture, in a functional approach. How are all the systems interrelated? You cannot just treat something in a vacuum, any part of the body. If that's what's happening, you're going to get poor treatment or unnecessary treatment. And you're going to have to, end up paying for something. And then the worst possible thing that could happen is that you're getting unnecessary treatment, and then there are sequelae or side effects to that treatment. Something goes wrong. It's a double whammy. And so again, the best dentistry is no dentistry. I know that sounds very trite and silly, but I've been saying that for a long time. But I really mean it when I say that. Get educated, find out what you can do to prevent the need for all of this. And I know it's a very big task for parents and dads and moms and even individuals, because there's so many other things to worry about. But again, it's like financial health, and you have to think ahead. You have to plan. You have to be an expert at that so that you have a good life and a uneventful life. Obviously, you don't want to have a non-eventful life. You want to have great things happen to you. But when it comes to medicine, you want everything to be your health. You want everything to be unremarkable and uneventful. That is the best case scenario. And the less treatment you can get, the better, not especially, but definitely at the dentist. And that's why seeing a dentist on a regular basis is a good idea, because you can catch things early.
One of the challenges with dentistry and medicine is that a lot of the modern dentists and doctors aren't tuned into what we're talking about today. So again, we're busy, like you said, And the people that we should be able to trust for this information aren't likely going to be at this level for what we're talking about today. Which takes me to, and you mentioned this before, giving me a few recommendations of, I forget what we were talking about at the time, but you mentioned being able to recommend some dentists in that area. What is somebody to do? Because people are tuning into this from all around the world. How do they go about finding a dentist they can trust in their area? What are some different things they need to look out for?
That is probably the most important thing we can talk about today, is finding the right provider. And that goes for anything, finding the right person to cut your hair. I mean, it doesn't matter. That really is so important. Safety, going down the right path in terms of triage and treatment. There is a real cookie cutter approach out there. It's happening in the US. It's private equity is on the rise. It's growing even faster. I just read something this morning on that. It's growing even faster now at a bigger rate. I mean, these are private equity firms that own the emergency rooms in the US. They own dental offices, and it's all about managing cost. And that's it, nothing else. I'm not against managing cost, but just managing cost and not allowing a practitioner to nuance and to really make sure they're treating the patient correctly with the right methods and techniques and surgeries and all that. That is very, very important. So how do you find, in that kind of environment, how do you find someone? Well, this is an issue that my daughter and I kind of addressed a while ago. We created this problem. We educated a whole bunch of people when we started our website 10 years ago, Ask the Dentist, and we realized that we had educated everyone, and then the back talk was like, okay, love what you're saying. I get it. It makes sense, but I can't find anyone that will answer my questions and address things the way you are. And so we created a directory of functional dentists. So that's one resource. So if you're just looking for a good dentist, and of course it's not perfect, we do have some in Toronto area. I know that, and they're all over the world. It's a list of it's growing, maybe 250. But anyway, look at our directory on our website. That's a good place to start. If your child, or if you're having sleep disorder breathing issues, or if you think you have sleep apnea, go to the aadsm.org website. That's where I learned all of my sleep dental medicine, and that they have a growing number there of accredited dentists that can get you up to speed a lot quicker than physicians can. They work with physicians. I'm not saying they wouldn't work with a physician, but in terms of getting diagnosed and getting treated, the path is a lot clearer and quicker, and that's important, ironically. But dentists can see it a lot earlier. And then there's asking friends and loved ones at work, and again, don't ask someone who has perfect dental health, because they're really just giving you a referral for the hygienist, and that's important. I mean, I love the office. It's great. How often do you see the dentist? Have you ever had any procedures done? No. Well, you're getting a referral for the hygienist, and that's important. But find someone that's had a lot of dental work done, and specifically in the area that you're looking at. You may have gum disease. Find someone that you know that has had gum surgery. That's a good place to start. That's a kind of a just research, orientated kind of way of dealing with it. And then interviewing the dentist. If they don't agree to an interview, they're probably not someone you want to deal with from a personality standpoint. Find out what their philosophy is. Go to our website. There are other websites too on functional dentistry. Find out what you need to know. Don't go in blind. Don't trust any professional. Make sure you're well educated. There's a lot of information on the web now. And most of it's good, but find an influencer that you trust that is a clinician. I would stick with the ones that actually, are reading the science, reading the studies, but also have some clinical experience, and then learn from them. And then sometimes you can reach out to them directly and get information. I get that on Instagram a lot. I can't give dental advice, but the little bits of wisdom and little tidbits, it's like it'll be a small paragraph or a sentence, and then all of a sudden they know what to do. It's just steering them in the right direction. So again, no real great reply to your question, like, this is how you do it. I would stay away from Yelp. I would stay away from Google reviews and all that, because again, like Amazon reviews, do so at your own risk. There's a lot of games being played in that. You can pay for reviews. They get family members to review them, whatever. I mean, I'm just, I don't even bother wasting time with that. But do your own research. But I think the best advice I can give, other than those two directories, would be take matters in your own hands. Become educated. You're going to have to be pretty well informed, not on all the particulars, but big picture stuff. And in dentistry, you definitely want to be on the side of functional dentistry. Google it, look at it, and it'll make more sense to you than anything else you've ever been exposed to in dentistry. It's the long-term, big picture, global, systemic view of treatment, and that the mouth is not just one aspect of the body, and that a dentist is just working in that small vacuum, and then your physician isn't aware of what's going on in that mouth. It doesn't need to be that way. Is that the majority of what's being done today? Yes. But so the answer is you gotta, and it won't take long. It won't take long. Just get the information online, and you'll be able to arm yourself with enough information to be safe. And then last little bit of information. Anything sounds fishy, or if your gut is telling you, seriously, literally, that you're not sure about it, something was off a little bit, get a second opinion. And if your dentist doesn't like the fact that you're getting a second opinion, you've already done the right thing. You've learned a lot about the provider. So, second, I would encourage my patients. Sometimes if it's a big case and it's a lot of complexity to it, I say, and before you sign on the dotted line here, I would get a second and third opinion. See what's out there. And sometimes they do, and that's a good thing, because dentists do have different approaches, and you just have to be comfortable with that approach.
It is an interesting time, though, and a relatively big ask for people when it comes to medicine, dentistry, where you could make the analogy of bringing your car to the mechanic, where you assume they're an expert in that area and they're going to guide you on the best decision for your car at that time. And of course, there's good mechanics and bad ones, and good hairdressers and bad ones. Coming back to your haircut you're going to be getting later this week. But it's unfortunate that the experts aren't necessarily, and likely aren't, tuned into the nuance of what we're talking about today. And we do need to do our own homework, and to at least a certain level, become an expert in oral health, in medicine, so we can make good decisions in the current world when it comes to taking care of ourselves. So it's a very unique, and again, big-ish ask for people to be able to do this, but it's important. You really need to.
So true.
Dr. B, I want to end on this. Our last conversation, we had a lot of comments on YouTube asking about Dr. Ellie Phillips specifically. She has a protocol online. I know you're familiar with it. It's got some similarity to what we've talked about today, but some definite big differences too. In a really general sense, people want to know what you think of the way she goes about oral care.
Yeah, I get that question a lot. Actually, not as much as in the past, but I don't want to say anything negative about any practitioner. Again, I'm not sure if she is still working or not, but she is a clinician. I believe she is a dentist, as far as I know. But her protocol is as far to the opposite side of the ring than from what I believe, or most functional dentists believe, and even a lot of conventional dentists. It's a very interesting approach to dealing with oral health, and the overall view is that she has 4 or 5 or 6 different mouthwashes and products and toothpaste and gum, and I'm not sure if there's a specific protocol or order, but these are products that she recommends. And I've listened to some of her stuff, and some of her stuff is great online. But this protocol is very confusing and baffling to me because it really shows no respect or regard for the latest science in the oral care industry and profession, and that is the oral microbiome. And now, if you go back 10, 20 years ago, it would sound absolutely reasonable. I do like her product. I think the first recommendation she makes is the xylitol gum. Forget what the name is, but I like it. I mean, it makes sense, and I would support her on that. What she says about xylitol, the product itself looks pretty decent, and that makes sense. But all the other recommendations are something that maybe for a period of 2 weeks for an aggressive oral microbiome reset. Other than that, you would not be wanting to use this every day. Your blood pressure will go up, insulin resistance, you'll start gaining weight, you won't be very happy, you'll be miserable, you're going to start getting cavities, gum disease, bad breath. Again, I'm generalizing. I can support all of these facts. It's just not the science of today, and we know that by disrupting and disinfecting, killing bacteria, even though they come back in 10, 15 minutes, that this is not the way to go. You really want to be oral microbiome friendly. You do not want to disrupt or try and reset, or again, only if you are in really bad shape. But there's no daily taking down the oral microbiome. There is no good side to that. We've been doing that for over a century, actually longer. But with organized dentistry, we've been doing that for a long time, and it's still the number one disease in the world, tooth decay. It's not been working. In fact, a lot of practitioners, there's a pediatric dentist in Oregon, Dr. Stacy, who I think most of your viewers will know. She's seeing aggressive increase in decalcifications, white spot lesions. It's not getting better, even though we've had 100 years and more to really get it right. It's actually getting worse. And the reason for that is this kind of thinking. It has no scientific basis. There was no scientific basis back then, but we didn't have the science. So it was kind of just the logical thing to do, quote unquote. Clearly today it's not. It's an outmoded way of thinking, and I would steer people away from that kind of thinking. Again, in selected cases, there are products, some of them in our protocol, where if you used them aggressively for 2 weeks and then threw them away, stopped using them, and then started eating correctly, taking probiotics, working with your prebiotics, working with pH of saliva, and working with a dentist to try and rebuild and reset the oral microbiome. And again, none of those products would apply except for the xylitol gum. You would not want to see any of those products in that resetting of the oral microbiome.
And this ties back to what we were just talking about before, where in this day and age, people need to go to the internet and places like that to learn on their own, because likely their dentist isn't going to be up to snuff on what we're talking about. So people obviously are curious. They're commenting, asking your opinion. And we are in this world where people are becoming self-educated and bringing information to their doctor, to their dentist, and need to learn on their own. So I appreciate you sharing your thoughts, and I know a lot of people are going to appreciate that. Dr. B, we're going to link everything up, though, in the show notes, your FYGG brand, Ask the Dentist website, social media. Really enjoyed this. Always a pleasure to chat. Thank you.
Jesse, it's always the same back at you. And I just appreciate it that you are including and are very interested in oral health. It's I think it helps all of your patients, all of your viewers, and it is an integral part of overall health. So it should not be left behind.
It's not easy, but it's connected and it matters. Thank you again.
Connected. Yep. Thank you.
Now that you're done, you're going to want to stick around here and catch this other incredible episode. You don't want to miss it. I'll see you over there.
I found online Mad Hatter's disease. What is that? People making felt hats were using mercury as part of the process. They were known as Mad Hatters, right? Alice in Wonderland story, I was a Mad Hatter.